am in other states. Okay, so today's talk is on nutrition for kidney stones, and hopefully you're going to learn some things that you didn't know, and we'll go from there. So these are some of the questions that we're going to be answering today. We're going to do some statistics, some anatomy of the kidney a little bit, and then the main thing is, recommendations for prevention and also how to get rid of them once you have them. Okay, so this is an interesting demographic type chart. It shows risk, and if you look, the blue is, there's dark blue and light blue here, but right here in eastern Tennessee, if I can hold my hand steady, we're at a pretty high risk for kidney stones. And there's also, if you haven't heard of it, there's something called the kidney stone belt, and that's this red area right here. And the risk and the prevalence of kidney stones is much higher in this belt. And they think that the speculation is that it's because of the weather, because it's hotter, and so people are more dehydrated. And so they actually have maps of the globe, and there's a kidney belt that goes around the whole planet, a kidney stone belt, which is interesting. And so it doesn't prove, but it does definitely draw a correlation and an association between dehydration and hotter weather causing dehydration in humans and us getting kidney stones. Okay, so this is a map. It's from a long time ago. I looked for some ones that were closer to now, current, but this one was interesting. If you look, this black area is the prevalence of kidney stones over 13.2%, and this is for white men. So if you live in this area, you have the highest risk of kidney stones. Here's one for white women right here. And so if you live in that area as a white woman, you have a highest risk of kidney stones. Okay, so I think that this lecture might be appropriate for this neck of the woods, right? We've got something that is relevant to all of us. Okay, so kidney stone risk factors. I think this is a little bit basic, and we're definitely going to get into the science. But chronic dehydration, even a mild chronic dehydration, definitely contributes. This one we're going to go into a little bit more depth. You're going to find that this plays a lot more of a role than you think. And then definitely medicines, and then there's a genetic predisposition. Here are some symptoms. If you've had kidney stones, you know what the symptoms are. It's just agonizingly painful, so we'll go from there. All right, so there's all different kinds of kidney stones. So this is an interesting picture of a kidney, and I believe they're actually showing a uric acid stone here, which is not the most common, but the kidney filters all of our blood, and then what happens is the filtrate, that's our urine that's filtered out of our blood, that's the filtrate. If the filtrate has a high concentration of certain things, eventually those certain things will start precipitating out of the filtrate and causing the stones. So it really has to do with what's in your urine, right? And that has to do with what's in your blood, right? So we really need to talk about what's in our blood and why. Okay, so let's talk about the pain a little bit more. People usually have what we call flank pain. And the reason why it doesn't hurt like up front and it hurts more in the back is if you see from the side picture here, the kidneys are aligned more with the spine, so it's right in the back. Like that's where you'll feel the pain, and that's why. Now interestingly, once you pass a stone though, it's got to go down this very long hose here, and you're going to see that causes pain elsewhere. But when you think you have kidney stone pain, it's good to know that there are other things that cause kidney pain. So this slide is just for me to mention that there's all different kinds of kidney issues that can cause pain, and to make sure it's a stone that we're talking about. But I'm not going to talk about any of these other things. We're focusing only on stones, kidney stones. Okay, so there's your kidneys once again. The reason I would like you to see this picture is that this is a very long ureter, right? The ureters are super long and they go all the way to the bladder. So if the kidney stone breaks up and then you start passing it, you're like, yay, it's out of my kidney. But then if it's sharp, which most kidney stones are, you're going to have pain all the way down as the stone scratches the side of the ureter. And that's when you can start getting blood in the urine and that kind of thing. It's because of that painful process of going down the ureter. Okay, so then, all right, so so this is where the kidney pain would be, but then as the kidney stone goes down into your bladder, you get what's called referred pain. So you might get pain anywhere in this area, in these areas, because of the referred pain. Here's another little map. I like to show lots of pictures because it makes a point. And once again, the pain moves to the front and starts going down because the ureters move forward and go down into your bladder. All right, so then the pain starts coming here. Okay, so let's go on to the next one. So this is, once again, they're telling you how to differentiate between different kinds of abdominal pain, and they might have different reasons than you think. So usually if it's a kidney pain or a stone that's going down the ureter, it'll start hurting more in your groin, right? So you'll feel it back here, and then you'll feel it right here, but you won't feel it like up here usually, right? Okay, so it's good to just be aware. Let's see if I think. Okay, so there's all different kinds of kidney stones. Some people, if you've had some, then you're aware that there's all these different kinds. But the main thing is almost all kidney stones are calcium oxalate stones. And there's not as many uric acid stones, and I can't even pronounce that word, so I'm not going to try. So we're going to focus a lot on these, but many of the remedies that I talk about will help with all of them. And so, yeah, they look different, and here they are. So, and some studies say it's closer to 80. Like, you'll see this go from 65 to 80, wherever you read. Okay, so what do our kidneys do? Our kidneys are like a pool filter. So all of our blood filters through our kidneys. Some studies say 300 times. I read some other ones that say 60 times. So anywhere between 60 times and 300 times a day. I guess if you're running a marathon, maybe you would have more blood flow. But that's how many times your entire blood flow goes through your tiny little kidneys every single day. That's phenomenal. I mean, so your blood is just constantly being cleaned, and things are being removed from your blood and added back into your blood by your kidneys. And that makes our kidneys start getting gummed up with things unless we do things to flush them out and to clean them. And so it's important that we do things to keep our blood healthy. So it's like the pool. The pool filter won't get dirty if the pool water is clean already, right? And then, but eventually the pool filter will need to be cleaned, and so we have to flush it out. It's unfortunate we can't take them out and hose them off like we do a pool filter. Okay, so what do? Basically, they filter the blood, but they perform all kinds of other functions as well. That's quite fascinating. But today we're going to focus only on the kidney stone aspect of what they do. Okay, so what do? The blood enters the kidney from this artery right here, and I want you to notice something about this picture. If you look, the red arteries go to the periphery. They go to the outside of the kidneys, and then the blood's pushed back towards the interior of the kidney, right? So, and when that happens, that's where the blood's filtered, and so these little open areas here is where the filtrate comes out, which is our urine, and then it's collected, and then it goes down the ureter, okay? So right here where the filtrate collects is typically where the kidney stones start precipitating out of the filtrate. And that's where the problems happen. And they can get stuck way in these little calyces here, these little pockets, okay? And that's when it hurts. Okay, so it can get very complicated, and I'm not going to go into how complicated it is because our kidneys are amazing. They're not just filtering out stuff like a pool filter. They're like chemical filters. They recognize if there's too much sodium or potassium in the blood. They recognize everything, calcium, and they're constantly exchanging different minerals in order to keep homeostasis in our blood, so our blood is healthy. So they're really phenomenal organs. And so here, it can even get even more complicated. And so this is what our little tubules look like, and this is how all of the chemical exchange happens, is because of these distal convoluted tubules and all that. So we're not going to go into that. Let's just say it's a lot more complicated than it looks on how we get chemicals out of our blood, okay? And that means the oxalate, right? Because we're worried about the calcium oxalate and the uric acid that forms the stone right now. So this must not be. Usually these are working properly, it's just they're overworked because we're constantly putting into our blood something that is constantly having to be removed. Okay, so here's an anatomy of a real kidney. That's what a real kidney looks like, and we already talked about it's in these little pockets right here, right, that the kidney stones form. Okay, so let's keep going. All right, so what causes kidney stones to form in the first place? Well, the latest and greatest information, and I'm going to show you some studies, have to do with antibiotic use. And It's looking like we have a homeostasis in our gut microbiome. That's the microbiome in our intestines that helps make sure we're pulling the correct nutrients from our food and absorbing them. And if something gets through the intestinal walls, it gets into the bloodstream. And that's what we're concerned about, is the blood, because it's the health of the blood that contributes to whether or not we have kidney stones. So what happens is, if we mess up that microbiome in our gut, then it's looking like there are particular bacteria that are in healthy guts that have not been exposed to antibiotics that prevent oxalates from building up. So if you've used antibiotics, even within the last year, you have increased your risk of having kidney stones dramatically. So you have to repopulate your gut. So we're going to talk about how to do that. So another thing that can contribute to kidney stones is high oxalate in your filtrate, which is what we talked about already, which means there's a lot of, you're getting a lot of oxalates from your food, but only 20% of your oxalates come from your food. 80% of oxalates come from your body. Your body's making them and creating them. So that's something to keep in mind. Low citrates in your filtrate or in your urine, that's the same thing. Filtrate and urine are equivalents. And so we're going to talk about citrates a lot. And then you could potentially have high serum calcium in combination with a vitamin K2 deficiency, and then high blood sugar and insulin, and then a genetic predisposition. These are really the causes of, the main primary causes of kidney stones. Okay, so we're going to talk about each of those separately. This shows citrate issues. So basically, hypocitraturia, which is basically this hypo meaning low citrate increases your risk of bone disease in kidney stone patients. So it causes a lot of other problems. So you may not, if you have a predisposition to kidney stones, you may not be getting enough citrate in your diet. And so we're going to talk about how to increase that, okay, naturally. And also with supplements, so that both of them help. So also, remember we mentioned a few slides ago that people who get kidney stones have high serum calcium in their blood with, in combination, a vitamin K2 deficiency. So this is what that says right here, but blah, blah, blah. It suggests that vitamin K2 deficiency is a major cause of kidney stones, just like I said before. And you can read about it all down here, click on that link. Okay, what I like about K2, and if you've been to any of my other lectures, you'll know that I spend a lot of time talking. People like to take vitamin. This is a good chance for me to talk about this, and I don't have a slide for it, so I'll go back one here. But a lot of people, when COVID hit and when other, flu and viruses are going around, they take high quantities of D3, vitamin D3, because it's supposed to help boost your immune system and those kinds of things. And I love that. I love taking D3. It's fantastic, and they're right. It's good for you. So a lot of doctors will say, and this is regular Western allopathic medicine doctors will say, you need to take like 10,000 IUs if your vitamin D is low on your blood test or something. And I'm not going to disagree with that necessarily, but I will say it's very dangerous to take high-dose vitamin D3 without simultaneously taking vitamin K2. And the reason why is because D3 is extremely effective at making available to your body all of the calcium from your food. So if you take 10,000 IUs of vitamin D3, I can guarantee you your serum calcium level is going to go up. And if your serum calcium goes up without things in your blood able to take and escort that calcium where it needs to go, then it's going to start building up in your kidneys as kidney stones, and it's going to start, what I think is even more worrisome, it's going to start building up and contributing to atherosclerotic buildup, which is hardening and narrowing of the arteries. So it'll increase your cardiovascular risk. So while you're trying to boost your immune system by taking D3, you're increasing your risk of a heart disease, which is the #1 killer in this country, right? So the way to solve that problem is you take vitamin K2, which is another fat-soluble vitamin, at the same time that you take vitamin D3. You always take them together because K2 is sticky, and it, just like calcium is sticky, and it loves to chaperone and take the hand of the calcium in your blood and take it to your bones where it's supposed to be, right? So it will prevent the increasing risk of cardiovascular disease. So if you look here, I recommend everyone, if you're going to take a vitamin D supplement, you take ADK. And here's two of them that I like. Vitamin A is another fat-soluble vitamin that also boosts your immune system, but those three are like a triumvirate. And you should imagine like a three-way teeter-totter, and if you increase one, you have to increase the other two. The reason other doctors don't tell you this is because they've had 0 hours of training in nutrition. So they just don't know, okay? They don't know that they're increasing your risk of a cardiovascular disease. But they are. So K2 is super important to prevent kidney stones because it takes that serum calcium and it escorts it to your bones, and it'll pull it out of your arteries, and it's going to pull it out or chelate. It will chelate it out of your kidneys and anywhere the calcium's not supposed to be. Okay, so how does antibiotics cause calcium oxalate stones? And the answer is, we've now found a bacteria, Oxalobacter formigenes, that we have now discovered is a particular bacteria that populates our gut. Not everyone's gut, but a lot of people's. And the people who have this bacteria in their gut don't get kidney stones. And it's because that particular bacteria prevents oxalates from forming. Okay? And it dissolves the oxalates and gets rid of them, so you never have the problem. And so how do you get this bacteria? And so I looked everywhere. Can you buy that in a probiotic blend? Can you look for that bacteria? And the answer is no. We don't know where it comes from, which is very annoying. So factors related to the colonization of this bacteria in U.S. adults, and basically they're talking about how people who take erythromycin and azithromycin antibiotics, it was clearly associated with the prevalence of their kidney stones. So there's a lot of work out there right now, and we're trying to figure out how to use this therapeutically. But they have shown that people who regularly eat live fermented foods will naturally populate their gut with this bacteria. So you can do it. We just don't know what exactly. This is the food that has it, right? We don't know. So here's more. It helps break down harmful stuff, so that way your liver and your kidneys don't have to filter it out. All right, here's another little thing. It reduces oxalate absorption. Here's the bacteria, and it's a reduction of the oxalate. So basically, it prevents you from having too much oxalates. And so one of the number one things I would recommend you do as a lifestyle habit to prevent kidney stones is to eat fermented foods. And we're going to talk about what some good ones that are around everywhere. Here's another one. May reduce the risk of calcium oxalate stones, this bacteria right here, right? So there's a lot of work out there right now on this, and it's important. 90% reduction in risk, just having that bacteria in your gut, which is crazy. So every time you take antibiotics, you have to remember, while you're solving one problem, and I appreciate that, you may be causing other problems, and you have to actively work on repopulating your microbiome. Okay, so Tums, this one is worth a big giant slide all to itself, because a lot of people take this for heartburn, and I want you to see what the ingredients are. Calcium carbonate, 1,000 milligrams. That is a lot of calcium, okay? That's a lot of calcium. So let's say you're taking vitamin D3, 5,000 or 10,000 I use every day, and you get heartburn every day, so you take a couple Tums each day, 1 or 2, maybe 3, right? You have so much serum calcium, floating around in your bloodstream that in your kidneys have to filter all that out, right? So you're just making that filtrate, that urine filtrate, really high on a chronic day-to-day basis of calcium, and it has to get it out. So it's better to not use Tums. I don't recommend Tums for any reason. High serum calcium also contributes to coronary artery disease and cardiovascular disease, so it's not something I recommend anyone take ever. I flip out a little bit when I find out that my patients or clients take it, because it's so dangerous in my opinion. These are much better alternatives. So I understand heartburn is something, and this lecture is not about heartburn, but I figured since it's such a problem with so many people, especially as we age, that I want to give you some alternatives. This is a better alternative. It's milk with magnesia. It will not raise your serum calcium, so I like that. I like that a lot, okay? This is a much better alternative, and this is a peppermint oil, but it also has ginger and fennel oil. It works phenomenally well. So let's say 2 hours after dinner, or you're right about to go to bed at night and you start feeling that uncomfortable heartburny sensation, this is what you should take. It works really well. This is another one, same thing, peppermint, ginger, and fennel. It's like an amazing combination, and it works very quickly. Within 10 minutes, your heartburn starts going away. I'll talk about how to prevent the heartburn in the first place, but if you have the symptoms of heartburn, take this, don't take Tums, okay? And then here's another one that I ended up taking last night, and I very rarely take it, but I had a really bad stomach ache and problems, and so I started taking it. And this one I like because it has peppermint oil, which is great for relieving heartburn, but it also has activated charcoal. So if there's anything in your gut that's just cause an inflammation, like causing things to really feel horrible. This will absorb it, the charcoal binds to it and helps you get rid of it. So that also works fantastic for heartburn. So I've just given you like 3 or 4 alternatives of something besides Tums to take, and you should give it a try, because remember, the Tums are going to increase your risk of kidney stones. Okay, so I have a whole little slide here explaining why Tums are bad for you, or why any stomach acid suppressor is bad. That would be famotidine, that would be Pepcid. Any stomach acid suppressor is very bad for your kidneys, very bad for your kidneys. So when I look at people's blood work, and they show me, and they say, hey, you know, Dr. Deb, my kidneys, my GFR, that's your glomerular filtration rate, my GFR is going down, down, down. It's getting horrible, you know, and the doctor says, we just got to keep an eye on it, you know, but I'm already in stage 3 chronic kidney failure, right? And so why is it going down? And the first thing I ask them is, are you taking stomach acid suppressors? Omeprazole, right? You know, anything like that. Because if you take a stomach acid suppressor, you can't break the peptide chains that are in your proteins. So you eat a steak, you can't digest it. Because the first place and the only place you can break those peptide chains is with high stomach acid. So if you suppress your stomach acid, you can't break the peptide chains, so now all those long peptide chains get into your intestines, and you got to do something with them, but your intestines don't know what to do with those long peptide chains. So instead, your kidneys have to filter it out. So you pee out every steak you eat. You're literally peeing out your steak. Yes, you have a question?
We have very hard water. Does the calcium in that have any effect?
That, I have not read any studies, okay? But I will tell you, I steam distill all my drinking water in my household for myself and for my parents, just because there's so much calcium that, I mean, when I steam distill 1 gallon, I can practically scrape up the calcium in my hand. That's how much calcium. And my dad has had double bypass and has, you know, and I do not want any extra calcium in our diet, like at all, because it's very bad for your arteries and for increasing coronary risk. So the answer is, I choose, okay, to steam distill my water. Now, and then I add trace minerals back in. I have a liquid trace minerals, and I add them back in, because if you don't have minerals in your water, it'll pull it out of your bones. I mean, it's not good for you. You got to have the minerals back in.
RO work just as well?
I'm sorry, what?
Reverse osmosis? Or?
That is debatable, and I would say that's what I used all through medical school was reverse osmosis, because I didn't have time to steam distill my water. So it's better than nothing. I can't tell you definitively if one is better than the other. I feel like, but it's only my opinion. So yeah, I think reverse osmosis is my next best choice, okay? But I would have to look into whether or not there are studies to prove that it removes all the calcium, but I suspect it does bind to a lot, especially if you use the carbon filtration too. Calcium is very, very sticky, and molecularly it's calcium +2, right? That has 2 pluses. That means it's very positively charged, and it wants to bind to something, right? And usually that's your arterial walls. But in water, if you have it going through a water filter, anything you can do to, like, you know, get it to stick to something else besides, you know, so it gets out of the water, it'll be good. Okay, so if you suppress your stomach acid, you're overworking your kidneys, okay? You're overworking your kidneys because you can't digest your protein, and that means you can't build lean muscle mass. It means you're more tired and lethargic than usual, all kinds of host of problems, you know. So I work really hard to get people off of omeprazole and famotidine, and then their kidney function goes, within 3 months, their kidneys will be at optimal GFR again, which is just amazing. I've seen unbelievable reversals. Okay, so then also you'll be protein deficient. So even though you're eating tons of protein, you're not digesting it. It's not doing you any good. And then lastly, if you're taking Tums for your heartburn because of the stomach acid suppressor, because one of the biggest things Tums will do, you know, you take it later when after you suppress your stomach acid, but sometimes people will still take Tums. And if you do that, you're going to have too much calcium. So all these reasons, it's important to make your stomach healthy and your digestion healthy, so that way it doesn't lead to kidney stones. Because remember, your digestion is what determines what's in your blood, and what's in your blood is what determines what's in your urine, right? So we have to keep going back a step to figure out where the problem is. Okay, so Western medicine, what do we do? What does Western medicine do? That's regular allopathic medicine. If you go see a doctor here in the state of Tennessee, this is what they will, some of the things they may recommend depending on how bad your kidney stone is. They'll first say you need to increase your fluid intake, and that's because you want to dilute the filtrate. The filtrate that's coming out of your kidneys, you want it to be dilute, because things don't precipitate out of the filtrate unless it's concentrated. Okay, so having a dilute urine is very, very helpful. And remember we talked at the beginning about that kidney stone belt, right? That's all because of dehydration, right? So you got to increase your water consumption. You just do. So start drinking tons of tea, and I have a lot of tea back there that we can talk about. And that's a regular doctor recommendation. You can also take, sometimes they'll give you, if you're a chronic kidney stone sufferer, they'll prescribe potassium citrate for you. Okay, because remember I said you have high oxalates in your filtrate, and you have low citrate in your filtrate. Those are the two things that are the picture of a kidney stone urine, right? So we need to give you more citrate, and you can do that through food, or you can do it through a supplement. And the doctor will usually prescribe the supplement to get your citrate up. Now, why citrate? Well, citrate comes in many forms. You can get magnesium citrate, you can get, there's potassium citrate. Potassium citrate's the best for kidney stones, and citrate binds to that oxalate and that calcium and pulls it out so it won't stick and start, glomming up together and concentrating to make a stone. Otherwise, they'll do other things too, like this ultrasound shockwave stuff to try to crush the stone, and all these other things. And they work to a certain extent, and they can even go in percutaneously, which means they stick a needle through your skin and then get into the kidney to try to do the shockwave stuff. And then, I think I already said that, potassium citrate. They'll give you hydrochlorothiazide a lot of times, which is a very mild diuretic that's usually used for blood pressure, and that just makes you pee more. And that's because you got to start flushing. It's sort of like, using the hose to rinse out your pool filter. You've got to get tons and tons of water through there. But I would say even not just water, you want the filtrate to have high citrate and low oxalate, right? So a lot of volume. And then they can do surgery to remove them. Okay, so this is just the picture that I already had there. All right, so this is just a graph that shows, okay, you can do extracorporeal lithotripsy, and then intracorporeal lithotripsy, which is that ultrasonic sound wave. And this is all the ways that you can get rid of kidney stones. Okay, so here's the potassium citrate, that one of them, you can get a million different kinds, but this is one on Amazon that I like now, is a good brand. This brand is pretty good. And this would be a great one. It's very inexpensive, so less than $7, right? That would be a great way to increase your citrate if you want to take a supplement. But I'm going to show you some other ways to do it without even doing supplements. And so why does it work? It binds. We're not going to go into the complexities today. I can go down the rabbit hole sometimes on my lectures, and I'm trying to stay informative. Okay, so now we're to this is my favorite slide. What are the naturopathic things that you can do? What are the natural things that you can do to get rid of your kidney stones? All right, so to help dissolve and pass them. These are the three main things. You adjust your fluid intake, adjust your diet, and you can take some supplements. Those are the three big things that I go for. There's a couple other ones too, like using a percussive device on your back, which I'm going to talk about. Okay, so we're going to talk about all of these in depth, and I'm going to review at the end. So first, medical and dietary therapy for kidney stone prevention. And if you look at it, once again, it says that citrate binds with calcium, specifically urinary calcium, right? With the calcium that's in your filtrate. That's what you want to do. That's where you want it to bind, right? So, and it does it by and it also binds with the calcium oxalate crystals to prevent crystal growth. So hypocitraturia, remember that was at the very beginning slide. I said, what are the causes of kidney stones? That was one of the causes, right? Okay, so how many people with kidney stones have low citrate in their filtrate, in their urine? About 60%. So there's high likelihood that this is an issue, right? So what can you do? The answer is consuming just 4 ounces of lemon juice per day is basically equivalent to the pharmacological dose of potassium citrate that they would give you, right? So just 4 ounces of fresh squeezed lemon juice. But you'd have to do it each day, so you got to get used to eating lemons, right? Okay, so here it is again. So, oh no, this is another one. Sorry, now we're going to go on to, I have another slide though that talks about lemons, so we're not totally done with lemons. All right, so the next one, remember I said that another cause of kidney stones was high serum calcium in combination with low or deficient vitamin K2. Remember, vitamin K2 you should always take with D3. It's a fat-soluble vitamin that takes the hand of the calcium in your blood and it chaperones it to your bones. So it's really important for women too, because we get osteoporosis, so it's really great for alleviating, preventing osteoporosis. But once again, significantly improves vascular calcification. So if you happen to have if you have coronary artery disease or cardiovascular disease or a high heart disease risk, you should be taking this anyway, because it's not only going to help prevent kidney stones, but it's going to help prevent you or lower your risk of having a coronary event. Okay? All right, so you can read all about it at this link right here. All right, so the kidneys accumulate, I think I already showed this slide, didn't I? Okay, so we're going to keep going. But basically, vitamin K2 is a major cause of kidney stones. I'm sorry, I repeated that. So where can you get vitamin K2? People always ask me, like, what's the food source of vitamin K2? Well, the food source for vitamin K2 is a Japanese food called natto. And if that looks a little gross, it actually tastes and smells worse. Okay, it is, for most Americans, we find it, I would almost say, for me, it's the worst food on the planet. It really is awful. It's very awful. Now, some Japanese, and I've known one Japanese classmate of mine in medical school, she would eat it for breakfast, because that's apparently how they eat it. Japanese people will put it on top of rice and they eat it for breakfast, and it's an acquired taste, but I find it impossible to eat. Like, I can't eat it. But if you look, 1,000 mcgs of natto per 100 gram of food. And look, the next one is another natto. So instead of fermenting soybeans, they fermented black beans to make the same thing, natto, right? Yeah, no, I'm not going to eat that. So then, what's the next one? Well, cheese, Gouda cheese, but only 73 compared to 1,000. I mean, it's not even comparable, right? So when I say the food that has it, it's natto, right? So I can't regularly eat enough food to get the vitamin K that I need to lower my risk of cardiovascular issues and to prevent myself from having osteoporosis, since I'm in menopause, so I need to worry about that, and all of the things I need my calcium for. I have to take a supplement. So I personally take a vitamin K2 supplement. I usually take it like this right here with my ADK. So I just take 1 pill a day, and that's usually enough unless my blood tests show that my vitamin D is getting low. That's what I take, okay? But for people who have kidney stones or a higher risk of heart disease, I would recommend taking a vitamin K supplement. Here's more foods that have even less of K2. These are the two that are very inexpensive, brands that I give my clients all the time. You can buy them on Amazon, and they work great.
Is that in the slides? I mean, in the thing we...
It's in the presentation. You're going to get this whole presentation.
We're going to get the whole thing.
Yep, you're going to get this entire presentation.
Okay.
So these are the two, and I've bought both of them, for my clients. I told them to buy them, and I want you to notice something. And this lecture is not about this particular issue, but if you look, it says MK7 here, and this one says MK7 right here. Make sure you get one that has MK7. There's 2 forms. There's actually more than 2, but we won't go into that. The 2 main forms are MK7 and MK4, okay? And MK7 is what you want specifically for calcium binding, okay? So that's what I would recommend. Although MK4 still works a little bit, but these are the ones. There's a lot of studies. I could do a whole hour just on vitamin K2. Okay, so what else would I give you? So if you came to me as a client and said, I need to pass this kidney stone, I'm in pain, what do? I would tell you to take 500 mcgs a day of this, okay? This is 100, so you'd have to take 5 capsules a day. This is if you have an active, acute kidney stone that's causing you pain, right? Okay? And normally it would be 100 to 200 a day for most people, right? But I'd up it to between 500 and 600 depending on how much pain you're in, because you want that stone to dissolve. And remember, K2 likes calcium, it binds to it and chelates it, right? So over time, it just starts dissolving it. Now, Champapiedra is a herb, and the Latin name is Philanthus, whatever. So that is actually the common name of the plant, and it is very effective, I have found clinically, to help dissolve stones. But it also forces you to drink more water. So like it comes in a 4-pack, right? And I always have these on hand to give to my clients, and I just say drink it all day long. Just drink it all day long while you're having an acute pain attack, right? It works really well. And then, depending on how bad it is and how much pain, if you're incapacitated or whatever, vomiting and, you know, like a lot of, you'd have to talk to me to get specific doses depending on, you know, where you're at in your kidney stone adventure. But this is another thing, if you came to see me, you would walk out the door with, right? It's a herbal tincture called Stonebreaker, and the main ingredient is Champapiedra. It also has hydrangea in it, which is another herb that's been used traditionally to dissolve stones. And both of them bind to calcium, and they help, over time, dissolve the stone. But at the very least, it's helping you drink more water. So I don't like giving these in a tablet form. I like giving them and having you put them in water and drink them, because you need to be drinking as much fluid as possible, right? So you might as well get a 2-for-1 special and drink it as a tea. You can put a whole dropper full, you could put up to 3 dropperfuls of this in your tea and just drink it just to get even more Champapiedra, you know, a lot of concentration. But you can get it in tablet form. If that's going to be easier for you to be compliant, then that would be what I would say to do. But these are my 2 recommendations right here. Okay, so there are other herbs that are helpful, but I would call them much less helpful than the one I just mentioned. Okay, so I wouldn't necessarily have you go and get this one, but as a preventative thing, like if you want to prevent kidney stones, nettle leaf tea is very, very good for you. It's nutritive, number one, it has a lot of nutrition, but it also supports your kidney health, and it's a powerful diuretic. So the doctors, remember I said allopathic medicine would give you hydrochlorothiazide. That would be something that they would prescribe to you if you had kidney stones because they want you to pee, right? Okay? Well, you could take the hydrochlorothiazide or you could drink nettle leaf tea. And that's going to make you pee, because number one, you're drinking it, but you're also, and it's very nutritive, so it's giving you all kinds of other minerals that are very good for you. Okay, so another one that I have not personally used, but I've heard good things about it, is banana stem. And you can buy it in jars like this or make it yourself. Basically, it's rich in potassium and citric acid, so it's similar, it's on the same lines of drinking lemon juice, right? So if this appeals to you more to do something different and interesting, go for it, give it a try. You can order it online, you can order the powder online, mix it with water, you can buy, you can do it. I have never tried it, so I can't speak for it, but apparently it's extremely effective, just like lemons are extremely effective. So there you go. Some other herbs that are indirectly helpful for the kidneys and to support the kidney health is salt cleavers, which is, that's what's in the background here. It's that little tiny plant that sticks to you a little bit. It's like sticky, it cleaves to you. It's like a little weed all over the place. Even on this block right here, there's some cleavers. Unless I think my parents eradicated our garden bed of it. But it's a common weed in the summer. And then juniper berries, and parsley, and celery seed extracts specifically. So you're going to see a lot of stuff online. You're going to see, if you go to Amazon and you're like, kidney stone cure, this will come up. That's been rated like an F, by the way. I looked at, how effective it is. But there is a combination of these herbs in it. Does that make sense? So like this one right here, Stonebreaker pill, it has celery seed, it has Champapiedra, and it has saw palmetto, right? So these 2 would be good ones that I approve. This one right here has all of these herbs, and if you look, it has juniper berry, Champapiedra, stinging nettle. Those 3 should look familiar because we've talked about them. The other ones are limited effectiveness. They might help a little. This one would help more with your bladder, and that's why they have bladder support there. So I don't like watering down my herbs too much. So in other words, if you're just looking for a kidney and bladder tonifying thing, this would be a great one. But if you are having an acute, attack of pain, you want to take the herb in a medicinal strength, in a therapeutic dose, right? You don't want to be taking a tea that has, 7 ingredients and only one of them is Champapiedra, right? You want to take high dose Champapiedra, right? That's the way it's going to be therapeutically effective. So I don't recommend any of these, to be honest with you. except for prevention and tonifying that whole organ system. Okay, so this one you might find online, and it says it's like 99% effective, right? And 99% inhibition of calcium oxalate crystals. And so my first question is, what's in it? What's in it, right? So I'm going to tell you what's in it. Vitamin B6, magnesium as citrate. Remember I said potassium, citrate, but it also, you can get magnesium citrate. So this is basically citrate. And then citric acid, which is not the correct form, by the way, of the citrate that you want. And I'm not going to go into a biochemistry lecture, but your body can convert it into citrate, which is helpful. And then it has phytid, which basically this is vitamin B6, which is what that is, vitamin B6. It's just biochemically further down the chain, and it's still not the form of B6 I want you to take for kidney stones. And then this is banana stem. So basically, if I had to summarize this, I would say it's lemon juice, right? Citrate. It's B6. That's it. That's basically what it is. You could get the same effect of this by drinking 4 ounces of lemon juice, right? And then taking vitamin B6 in the correct form, which I'm about to go through. So this is expensive, and I'm sure it's effective because it has what you need, but you don't need it. Does that make sense? You can get the same effect using lemon juice and a B6 supplement that I'll show you. Okay, so I think I showed, did I show you this one already? I don't think I showed you this one. So what you're looking at in the background is a whole bunch of lemon juice that's been frozen in ice cube trays. That's a great thing to do if you have kidney stones, or if you're prone to kidney stones, just squeeze a bunch of lemon juice, fresh squeezed, put it in ice cube trays and freeze them, and then if you want a cold drink, just break them up and put them in your glass, and then you'll very easily get to your half a cup. You only need a half a cup of lemon juice a day, right? Half a cup of pure lemon juice a day provides the same amount of citric acid as a pharmacological therapy, right? So, you know, when the doctor prescribes you potassium citrate, like that's what you could get the same thing from half a cup of lemon juice. You just have to do it every day, right? So make it enjoyable. You know, make your little ice cube trays and get a cold drink, right? Just get used to drinking lemon juice. Okay, just try not to add a whole lot of sugar and stuff. So this is the form of B6. So studies have shown that B6 helps, vitamin B6 helps with kidney stones. And if you look right here, it says, and it works better in combination with magnesium, preferably magnesium citrate again, right? And so that will inhibit the stone formation. So P5P is just a bioavailable form of B6. So it's the same thing. B6 and P5P are the same thing. But you might see B6 called IP6, okay? You might see a vitamin, or you might see it called myo-inositol. You might see it called, what it was back here on this slide, hold on, right on this one, hold on, right here. It was called, the B6 alone is pyridoxine hydrochloride, and then this one's inositol hexakisphosphate. All of that is B6. All of those are B6, okay? And so I could go into the biochemistry and show you how they change and which enzymes contribute, but the thing you need to know is this is the form of B6 that's going to help you the most get rid of your kidney stones. It's the most bioavailable. It's the easiest on your body. And this is very inexpensive, and it comes with magnesium in it, so it's even better. So I've had great results with this. So if you just took one of these a day, and then you took 4 ounces, you know, your half a cup of fresh squeezed lemon juice, you would be well on your way to making, you know, getting rid of your kidney stones. Okay, so another thing you can do, these are side things you can do. You can use a percussive massage gun on your flank area. So she has it pretty low. I'd probably do it a little bit higher, but they've shown that mechanical percussion, and that's what this is, mechanical percussion, okay, is safe and effective treatment option for residual lowering of your calcification fragments 3 months after. So basically they're saying, let's say they did the ultrasound procedure on you, you know, percutaneous or whatever, and they broke up the stones, but you still have some stone fragments and you're having a hard time passing them, you can get rid of them. Nearly 50% of the patients are stone-free when they use this. So what that means is if you have a small stone that's not so big that you have to go get this procedure done, you could probably get rid of it by doing mechanical percussion, okay? So it's something to consider, right?
That,
Is the vibration make it go through the tube?
Yeah,
Is that what you're saying?
yeah, but it's not just vibration. I'm being very specific in my word choice, and I'm using percussion. So if you look here, you want a gun that says percussive. You really, because it has a different way of, it's an impact, right? And it's less of a, right? It's more of a boom, 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 right? So you have to make sure when you're going to buy it that it's a percussive massager, okay? And because that's the motion you want, that's been proven to be more effective. Yes?
it says 10 speeds, so would you want to do it on the lower end or the higher end?
All percussive devices are going to be different, so like I can't even say, I don't know. I'm going to be honest with you, I don't know. I would personally use it on the setting that felt like I was feeling the biggest pounding, right? But I can't tell you, I don't know. Okay, I'm sorry.
It's fine.
I would have to go back to this study right here and see if they actually talked about the amplitude, and then I'd have to equate that to my massage gun, and I'm sure there's a way to do that. Interestingly, I thought about what you said, which was, would any vibration, if mechanical percussion, which is like this, if that's going to help, would a vibration help? And because people will stand on whole body vibration plates and stuff, would a whole body vibration plate that just vibrates you at a high frequency, would that help? And the answer was no. Okay? So whole body vibration does not work, okay? So just regular vibration does not work. I looked up therapeutic ultrasound, which is, because since the other ultrasound worked at those other frequencies, I thought maybe therapeutic ultrasound, because I have a therapeutic ultrasound machine, which I've been meaning to tell you. And you can use it for hand issues, de Quervain syndrome, and I use 1 megahertz and 3 megahertz, and I was thinking, well, maybe that would help, right? And the answer was no. That does not help. It's been shown that, and I was thinking, okay, well, what about red light therapy photobiomodulation? Because I have a red light therapy device, and I do photobiomodulation, and it helps with all kinds of other things, and the answer was no, that does not help. So I looked into everything I could think of that was natural that could help kidney stones, and really the only thing was mechanical percussion. Okay, that was it. So there you go. And like this was one I found that was a great deal right now that I had someone recently get that for pneumonia. Pneumonia seems to be going around right now. This respiratory crap is just going across the country right now. And so a lot of people are getting pneumonia and they're on antibiotics and they're on all kinds of things, but it's still not helping. It's still like dragging on. One of the best things you can do for pneumonia, if you have a device like this, is you can either have a buddy or a partner in your house, or you can buy a thing that'll help you hold it for yourself. You want to breathe, nebulize some saline water, and the salt will help kill what's in your lungs, but then after you nebulize, you have someone percuss with a device like this your posterior lung fields, and it will make you cough up and get out, expectorate what's in your lungs, and it will make you heal from lung issues faster. It's good for COPD, it's good for pneumonia, it's good for bronchitis, right? So having a $40 percussive device like this has multiple uses, right? There is a massage technique that's called depotement that works also very, very well as a way to help you cough up things if you have pneumonia, but it's also good for kidney stones. So there you go, side benefit. All right, so I'm sorry, I digress very easy. Okay, so we talked at the beginning about, what causes kidney stones, and the first thing I mentioned was a basically gut dysbiosis caused primarily from antibiotic use, right? So if you can get a diverse gut microbiome, so a healthy microbiome is a diverse microbiome. You want as many different kinds of bacteria in your gut as possible. The way you do that is, and remember, we don't know which food particularly has that Oxalobacter formigenes, we don't know which one has it, but they have proven in studies that if you eat a little bit, just a couple bites of fermented food every day, you will repopulate your gut with that bacteria and it will help prevent kidney stones. So start to learn to like sauerkraut. I will tell you, this one right here is my absolute favorite. I love it. This is my second favorite, really good. You can get it at Costco for practically nothing. It's very, very inexpensive. These are my two favorites, but you can see in grocery stores now, in the refrigerated section, all these little bags of fermented foods. Give them a try, just buy a little bag of one of them, give them a try. They're not They're not bad, they grow on you. But they also have kimchi, and you can get, like we just ate recently, we've been eating on a jar of fermented okra, so like okra pickles, you know? And so you can get real pickles if they're live fermented pickles in the refrigerated section, pickles would be a great option. Eat a pickle once a day, you know? Eat an okra once a day. There's just so many fermented foods now you can choose from. We're very, very lucky. But yes, it says vitamins as regulators, and then this link right here is another one I didn't even put on there's many, many studies out there showing that bacteria in your gut, not just that one, but that's the main one, all of it helps you not have kidney stones. Okay, so then we're going to talk about some things that people think, well, what about apple cider vinegar? I've heard through the grapevine, you know, that apple cider vinegar, I should be drinking it every day because that's going to help, right? It's going to help my kidney stones. And so this one, I'm going to say I'm neutral on, but probably I would not want you doing it. So neutral to no, okay? And the reason why, that's if you have an acute kidney pain, like an attack. Now, if you're trying to do preventative stuff, I'm less worried about it. But you have to know that apple cider vinegar alkalizes your blood and your urine. So here's another study. Let's go down here. An alkaline pH favors the crystallization of calcium and phosphate containing stones. That's exactly the wrong thing. This alkalizes it, and alkalization makes you have stones. So you don't want to alkalize your urine. You want to acidify your urine if you're trying to get rid of your stones. And apple cider vinegar will alkalize your blood and your urine, right? So now, apple cider vinegar does help you raise your hydrochloric acid before you eat your first bite of meal. So if you have heartburn, I really like people taking apple cider vinegar because you want that acid to increase in your stomach so you can digest your protein. It's easier in your kidneys, right? But if you have an acute pain, you know, from kidney issues, I would stay away from this right now. There was a lot of studies on this, and it was like 50-50. So it's not a big help, let's just put it that way. And it may actually hurt. So then some other old wives' tales. Everyone's like, oh, gotta drink beer. Beer's gonna, you know, help me get rid of my kidney stone. Well, okay, so why? Where did that come from? Well, it's a diuretic. Alcohol makes you pee more. But you can do that with the nettle tea back there, right? And the other teas that I've shown you. Also, it adds stress to your liver because you have to detoxify the alcohol. It also increases your uric acid, which means maybe it will help you potentially pass the stone then, but it makes your risk of having a kidney stone in the future worse. And it makes you gain weight. So there's 4 reasons why it's probably not your number one choice. Here are some things, if you look online, they'll tell you, these are some kidney stone remedies. I'd be very cautious with these because you need to understand why, right? Okay? And so they're wrong. Some of these are wrong. Like, for example, avoided non-fermented soy. It's funny that they said non-fermented because, we know that fermented soy is really great, right? Fermented soy is natto, and it's like super high in vitamin K2, which is great for kidney stones. So horsetail is it has silica, it's more lubricating and pain relieving. So all of these are, like lemon juice, absolutely, but in like raw apple cider vinegar, 50-50, dandelion root, I'm neutral on, it's nutritive. This one I was like, oh, well maybe that one has citrate. No, it doesn't have citrate. So like celery, yes, but usually you want the celery seed extract. So like these are very questionable advice, okay? I try to base the recommendations that I give people on therapeutically effective and clinically effective strategies, okay? These are not it. But drink water, absolutely. Okay, some of these, now that was good. Coconut water, I had at the beginning because you want the potassium, so that's great. Apple cider vinegar, not so much. I'm neutral on that one. Watermelon, yes, it has high citrate. Very high citrate in it, so if you like watermelon, go for it, okay? You can drink the juice. The thing is, it does have sugar in it, so if you have a tendency to high blood sugar, I think lemons are better. Honestly, lemons are my number one choice. And then kidney beans, I'm like, why kidney beans? So I looked them up. They have a little tiny minuscule amount of B6. Right? So if you want to get your B6, your vitamin B6 from your food, kidney beans is the way to go. But, I would recommend you take the P5P supplement and then drink your 4 ounces of lemon juice or your half a cup a day. All right, so here's the thing I had at the beginning, which was what are the naturopathic guidelines? We've gone through every single one of them. So increase your fluid intake, lemon, chancapieter, coconut water, herbal teas, supportive supplements, potassium citrate, magnesium citrate, K2 in the form of MK7, but make sure you take these at the same time. B6, magnesium citrate. Kava, I didn't mention because I didn't talk a lot about pain today, but these are the pain relieving ones, okay? So kava kava tinctures right here, it will numb your mouth, but you can take it orally, and it's an antispasmolytic, so it will help everything relax, so you can pass the stone easier, and it's pain relieving. So that could help. And then the DMSO gel, that one, there's minimal studies out, but there's some great anecdotal reports and reviews on using DMSO, topical DMSO gel, which is a sulfur, and you rub it on your flank area, and people say the pain goes away immediately. So that's something to consider for pain, is DMSO gel and then kava kava. And then down here, adjust your diet. So eat more leafy green vegetables, that will give you magnesium. Reduce your protein or moderate your protein and salt. Eat live fermented foods. That might be, I should have put number 1. That would be my number 1 dietary recommendation, is eat fermented foods. And then, reduce your fructose consumption, because that contributes to the oxalate formation. So there you go. That's really it. Here's some references, and I'm going to try, before I send it out, I'm going to try to put more in there, because I got about 15 more. And then there's my final slide, I always say. So thank you very much. You guys have been great.